have a list here of just a couple of them that we'll be discussing today. And if you can speak to this, Haronyd, Alzheimer's disease, multiple sclerosis, these are one of the common ones.
Right, so we have Alzheimer's disease, multiple sclerosis, amyotrophic lateral sclerosis, known as ALS, Parkinson's disease. So these are conditions that unfortunately will progress and worsen over time.
Okay.
So for some of these, there are periods of time that they're in remission, so we try to take advantage of those moments to work on strengthening and really get improved mobility. But unfortunately, there's no cure for these diseases, so they will get to a point where they'll need more help from the caregivers, more help from the family.
Now, when you mention remission, do you mean that the conditions itself are maybe not dormant, but more inactive?
Correct, yeah. They are kind of dormant in a way. They're not actively causing any kind of changes in medical status at that point.
Now, what's the difference between a degenerative condition to a neurologic condition?
So, for example, if we have a patient who's suffering from a stroke or who's had a brain injury, let's say, we can expect that we are going to see some improvements in the status medically and physically. Okay. With someone who's going through a degenerative condition, we will see it progress and worsen over time. So we just try to focus on prolonging their independence for as long as we possibly can, and definitely try to use all of our resources and any adaptive equipment that may be available to the patients.
Now, what are the goals of physical therapy for each patient?
Always our goal is to make sure that the patient is as safe as possible to perform any of the mobility activities. We do try to make sure that we give them a really great program as far as what they should be doing at home,
right.
As well as in the therapy, so that they can continue to progress outside of the session. It tends to be that our time is limited with the patients, so we do try to also focus on what are they going to do outside.